What tests diagnose pancreatic cancer? When it comes to diagnosing pancreatic cancer, a thorough approach is essential. The process typically starts with a review of medical history and a physical examination. If there are concerns, several tests are used to confirm the presence of cancer cells in the pancreas. Imaging tests play a crucial role. The computed tomography scan, often referred to as a CORT scan, is a detailed X-ray technique that provides cross-sectional images of the pancreas. A specialized version, known as multidetector row helical CORT, offers high-resolution images and is usually the first choice when pancreatic cancer is suspected. Another important imaging tool is the magnetic resonance imaging scan, or MRI. This test uses magnetic fields to create detailed images of the pancreas. A specific type of MRI, called magnetic resonance cholangiopancreatography, focuses on the pancreatic and bile ducts, helping to detect any abnormalities. Ultrasound is also utilized, starting with an abdominal ultrasound that uses sound waves to create images of the pancreas and surrounding organs. However, it is less sensitive than CORT or MRI. For a more precise examination, endoscopic ultrasound is performed. This involves inserting an endoscope through the digestive tract to get close-up images of the pancreas and allows for biopsy sampling if needed. A positron emission tomography scan, or PET scan, is another valuable tool. This scan involves injecting a radioactive sugar that cancer cells absorb more than normal cells. A special camera detects these areas, which is useful for identifying if cancer has spread. Endoscopic procedures are also significant in the diagnostic process. Endoscopic retrograde cholangiopancreatography, or ERCP, uses an endoscope to inject contrast dye into the bile and pancreatic ducts. This helps visualize any blockages or narrowing, and biopsies can be taken during the procedure. Laparoscopic ultrasound is another minimally invasive option, using a small camera and ultrasound probe to examine the pancreas and surrounding tissues. A biopsy is critical for confirming pancreatic cancer. This can be done during endoscopic ultrasound, ERCP, or through a fine needle aspiration. This method uses a thin needle to collect cells from the pancreas for microscopic examination by a pathologist. Blood tests are also part of the diagnostic process. While no blood test alone can definitively diagnose pancreatic cancer, certain tumor markers like Ca19-9 can be used as supportive tools. Elevated levels of Ca19-9 may suggest pancreatic cancer but are not conclusive. Other markers, such as carcinoembryonic antigen, Ca125, and Ca242, may also be evaluated alongside Ca19-9. In some cases, genetic counseling and testing may be recommended to assess inherited risk factors. A laparoscopy, a small surgical procedure to look inside the abdomen, might also be performed to check for cancer spread. The diagnostic journey typically begins with imaging tests like CORT or MRI when symptoms arise or clinical suspicion is present. If these tests suggest abnormalities, endoscopic procedures and biopsies follow to confirm the diagnosis and determine the cancer stage. Blood tests provide additional support but are not definitive on their own. This comprehensive approach ensures an accurate diagnosis, which is essential for planning effective treatment and preserving pancreas health. It is vital to have all testing and diagnosis managed by healthcare professionals who specialize in pancreatic diseases to ensure personalized and appropriate care. Always consult with healthcare professionals for the most accurate and tailored medical advice.